Good afternoon, everyone. You are very welcome to the How Podcasts Can Help Your Mental Health and Wellbeing webinar. The panel will be delighted to receive any questions you may have. Please use the Q&A feature located at the bottom of your PC or laptop screen. If you're using an iPad, you will find this feature located at the top of your screen. Without further ado, I will now hand you over to your host for today, Fergal Fox, Head of Stakeholder Engagement and Communications. Thank you.
Hello, everybody. Hello. Thank you for joining us today on this webinar, all about podcasts and how they can relate and support your health and well-being. We've been working on our own HSE Talk and Health and Wellbeing podcast for nearly 2 years now, and we'll tell you a bit more about that later. But we have a great lineup for you today. We have Síle Seoige coming up later on. We have Dr. Sharon Lambert, and we have Garry Kelly coming up next. You'll also meet my colleagues in my stakeholder engagement and communications team who've been working with us as hosts and doing the development work in the background on the HSE Talk and Health and Wellbeing podcast. So really appreciate your time and attention today. Just by way of introduction, as was said there, my name is Fergal Fox and I work for HSE Health and Wellbeing as the Head of Stakeholder Engagement and Communications. I also have a remit for men's health. But in recent years, I've been working in health and well-being for 22 years now, but in the last 5 years, the job has been around amplifying and trying to get the messages out about the work the HSE is doing in health and well-being under the Healthy Ireland framework. And that cuts across lots of different areas like physical activity, healthy eating, mental health, alcohol. And the podcast has been very useful to us in this regard. So we've had to, I suppose, working with a small team, the day-to-day work that we're usually involved in could be developing content for videos, for online programs, for webinars, working on our own website or newsletter. But the podcast was a kind of a new innovation last year. And I'm very conscious that not everybody listens to podcasts. So some of the information you're going to get today will be at a granular level about actually how you can listen to a podcast, as well as some of the messaging around how people use podcasts to support their health and well-being. So I hope you get something out of it. We have a short survey at the end of the webinar, and I really would appreciate your input into that to gather some views and maybe help us promote the podcast in the future. So first of all, anyway, I want to introduce you to Garry Kelly. Gary's been working with us very closely. His team is kind of working to edit and produce our podcast, and he's going to give you a short presentation about podcasts generally and how they've been used and the growing engagement in this area in recent years. So hand over to you, Garry.
Thanks very much, Fergal. I'll just share my PowerPoint. And thanks to everyone for hopping on today's meeting. So to tell you a little bit about myself, I actually started working in radio back in 2007 as a producer and presenter. And I worked both in local and national radio. And I started my first podcast 14 years ago called Organics Music, when it was a lot harder to record podcasts and it was even more complicated than you could imagine to upload it. But since then, technology has improved. The consumption of podcasts has risen. And I produce podcasts now for a number of organizations, including the HSC, Galway Races, a number of universities, and so on. But what is podcasting? Well, the term actually started off in 2001, portable on-demand broadcasting. And it's recording and making audio-based episodes available over the internet that can either be streamed online or you can download them and listen to them later. They can be played across internet-enabled devices like smartphones, tablets, laptops, computers, and smartphones are the #1 platform for consuming podcasts. There's a number of benefits. They're convenient, so you can listen to a podcast anytime, anywhere. I often listen to a podcast when I'm in the car driving to work because I live in Galway City and the traffic is pretty horrendous day and night. So this morning I was listening to Conan O'Brien interviewing Al Pacino, the actor. My wife listens to podcasts when she's at home cooking and when she's out walking the dog. So it's great. Unlike video, where you have a short window to get a message across and you need the viewer's full attention. With a podcast, people can multitask. So they can be doing various chores, going for a walk or whatever, and it doesn't require their full attention. And it gives the opportunity then for a deeper, longer form discussion. And people love podcasts because they get to learn something new. So the big thing at the moment is knowledge sharing. People love to consume new content, new material, and learn. And most podcasts are completely free. So some podcasters might have a subscription service where you get a bonus episode every week for an extra couple of euro, but most podcasts are free. So it's free content. And there's different formats. It can be interview-based, it can be stories, it can be comedy stuff, sports, and it's all building knowledge, giving new perspectives, ideas, cultures, broadening our worldview of topics and scenarios. And even Síle, if you look at the podcast, the episode she has released on her podcast over the last 6 months or so, very much focusing on highlighting and spotlighting issues happening abroad. So it's really good for content like that. And they're more casual. I suppose even when Conan O'Brien, who I would be a fan of, when he used to do his chat show, he had 7 minutes to interview someone, talk about their upcoming movie, and that was it. Whereas you actually get to learn a little bit more about the host because it is a more casual form of communication. And believe it or not, it's really good for your mental well-being because they're relaxed, there's comedy, it does reduce stress. Some people listen to podcasts to motivate them throughout the day. So it's a good form of consuming content. How popular are they? Well, Acast, who would be one of the main networks for hosting podcasts, has said that it is increasing and people are planning to increase their consumption of listening over the next 6 months. The JNLRs, which measure the amount of people listening to radio every 3 months, interestingly, JNLR figures are decreasing. So people are now beginning to listen less to radio. What is rising is the consumption of podcasts in Ireland. And Pure Telecom, who's an Irish company, released a survey last month saying that 72% of the Irish population listen to podcasts, and they listen for about 48 minutes per day. And the most popular genres are comedy, entertainment, true crime, and self-help and well-being. What's changing is people are now deciding what they want to listen to. So traditionally, we'd turn on the radio and whoever was being interviewed or whoever the host was, we just sat there and listened or drove in our cars, and we just had a loyalty to a particular radio station or a particular show, and that's what we listened to, no matter what the content was, no matter who the guest was. Same with television. We go on, we watch RT, whatever show was on, that's what we watched. Now people are choosing specifically what they want to watch or what they want to listen to. So my 2 children, they don't watch anything on television anymore. So Generation Z, Generation Alpha are really accelerating towards this niche learning and consumption of content. So they go to Netflix or YouTube and they choose what they want to watch. Same with all the other main channels like Disney, RT Player, and so on. So people's habits are changing. They know exactly whether they're looking for something funny or serious or news-based or sports-based, and they're going to specific places to seek out that content and consume it. So who is podcasting? Well, you have celebs like Jane Fonda, who now podcasts, Conan O'Brien, who I spoke about earlier. There's 3 actors called Sean Hayes from Will and Grace. You have Jason Bateman and Will Arnett from Arrested Development. 3 actors who've gotten together. They do a weekly television or podcast called Smartlist. In the middle, you have Alexandra Cooper, who has a podcast called Call Her Daddy. She has the highest paid podcast platform of all time as a female host, $60 million. She did a deal with Spotify. If you remember Cheers from the 80s, well, Woody Harrelson and Ted Danson have gotten together this year, and they are hosting a podcast called Where Everybody Knows Your Name. So fans of Cheers might enjoy that. Joe Rogan would be one of the top male podcasters out there. And from the UK, you'd have Stephen Bartlett, who you might remember from Dragon's Den. And then there's other actors and comedians as well, hosting podcasts on a weekly basis. In Ireland, the two Johnnies have been hosting a podcast for a number of years. They were working in 2FM for 2 years. And as of this summer, they've decided to leave traditional radio and continue their podcasting, but also do other initiatives. The idea of leaving radio to go podcasting years ago would seem absolutely absurd, but people are now doing podcasting because they can record whenever they want, wherever they want. They're not tied down to time limits. So on their show on 2FM, they'd have a certain time that the show had to be and so on. So all these limits, all these barriers are gone, and it really opens up a more interesting conversation. And in Ireland, you have some amazing podcasters. You have Vogue Williams and Joe McNally with My Therapy Ghosted Me. Deirdre O'Kane and Emma Doran, two comedians doing one. Nikki Byrne of Westlife has just started a podcast. Interestingly, Matt Cooper and Ivan Yates, two stalwarts of radio, are now podcasting. And the amazing Síle Seoige as well, for a number of years, is podcasting and has gone to #1 as well in Ireland this year. You have a number of categories you can choose from. So you have sport, well-being, news, science, relationships, anything you can think of, there's a podcast on it. So how do you listen? Well, the best thing to do is to download an app like Apple Podcasts or Spotify, or if you have an Android phone, Samsung Podcasts. Download it onto your phone, ideally. And then you can search out for a particular show if you know the name, or you can search for a particular topic or the name of a host or whatever. And it'll give you a variety of options. And you then subscribe or follow, depending what sort of app you're using. So, for instance, on Spotify, you would follow a show. On Apple Podcasts, you would subscribe to a show. And then you can download it to listen to it later, or you can just play it there and then. You can speed it up. If you want to play it faster, you can pause it, rewind it, and so on. You are in full control, and you can go off for a walk, plug in your headphones or your AirPods, and listen away. And you can create a playlist as well of your favorite podcasts. So we'll just finish up with this short video just to give you an idea of how to download an app onto your phone. So again, these podcast apps are free to download. So you can download from the App Store on your iPhone, or if you have an Android, download from Google Play. And I'd recommend that you either download Spotify or Apple Podcasts, as they are the two main podcast platforms. So you just open up your app. For instance, we have Spotify in this example. And then you click the search icon. And what I want you all to do today is to go up to the very top then into the search bar once you've downloaded Spotify onto your phone, if you haven't already, and type in HSE Talking Health and Wellbeing. The show will pop up. You click on it, and then you click follow. And any new episodes that arrive, you will find out about them. You can click notifications as well to become aware. And you just, there's over 70 episodes there now on that show. So there's plenty to scroll through, listen to. And I've been recording them for over a year with Fergal, Noreen and Eamon, and I'm learning so much from it as well. So there's a new episode that comes out every Wednesday. There's one out tomorrow on childhood obesity. And I highly recommend that you take time out for yourself because there's some really, really excellent content there for you to consume on the HSE Talking Health and Wellbeing podcast. Thank you.
Thank you, Garry. I really appreciate that. Thanks for those insights. So there's a lot of, I suppose, broad stuff and international perspectives there on the growing medium of podcasts. I just want to play a video first before I invite Eamon and Noreen up on screen here to discuss our own podcast and some of the learnings that we've got from it. And this audiogram will give you some insights into our own podcast series.
Fergal, just before we play that video, your camera seems to have stopped working. Garry, you are showing off your cup while he's doing that. That's great placement. But Fergal, while we play the video, if you have a camera attached to your laptop, if you could remove it and put it back in again, please. And we will share that video there now. You can mute yourself, Fergal, if you wish. Garry, you can mute yourself and turn your camera off. Thank you.
The leaders were fantastic. They ask you questions, but it's not like drilling into you to find out everything. It's just to know how you're feeling, how you're getting on, what do you do today, and the whole lot. And it was just mind blowing to meet these people. And again, as I said earlier, to see so many people with so many different illnesses or injuries or whatever, and they were so positive. They were just so positive. That's one of the first things I got out of the whole lot was positivity. I really am so positive now that I don't look back.
It's really only in the last kind of 10 years, even 5 and 6, where you can really see the advantages of digital for getting messages out there to young people around health and well-being and empowering them with information that they need that they're not getting in other places.
Initially at Electric Picnic, we got 47 samples. While that's numerically low, we got really rich data from those substances. So we had a series of new psychoactive substances, very unusual and novel psychedelics and stimulants. And from that one event, we had 4 drugs which have never been found before in Ireland. So we were able to update the EU early warning system that these drugs have been identified in the Irish context. So that's quite significant to the HSE, showing that this approach is reaching people we wouldn't otherwise reach, but also finding drugs that we don't know exist in Ireland.
Research tells us that that actually is the most important thing, the relationship between the parent and child. So parents put a lot of emphasis on getting it right. You know, sometimes feel they want to be the expert before they start a conversation with their child about this. But actually the thing is to build the warm, loving, connected relationship where you can have those little conversations that we all have in daily life. That's the key.
For us, it's really just about being able to provide a safe space for men to come and talk.
Yeah.
Now, whether it be about mental health, whether it be about your family issues, whatever it may be, it's like us men coming together to be able to help each other and support each other.
Mrs. O'Neill came out of that whole design of community healthcare organisations as that descriptive of the patient. A widow lives alone, 79, arthritis, heart disease, and so on, and wants good quality healthcare from professionals who talk to each other. And what I keep reminding people is the reason that paragraph was written was to describe the need for integrated care. And so I keep saying to people, you know, there are books written the world over on integrated care. Some of them are fantastic, some of them probably not so. But the point is, I keep saying, look how simple Mrs. O'Neill's ask is. Just look how simple it is. And look at how complex we've made the response.
Yeah.
And my job is to take the complexity out of the response so that Mrs. O'Neill gets what she needs and what she wants.
Thanks very much. Sorry, I had to jump on to Lisa's. Can you see me all right and hear me okay there?
That's absolutely perfect, Fergal. I'm going to rename you as well so people don't think you're Lisa. This is the joys of it.
Yeah, the choice of it. I just invite Eamon and Noreen to come on screen with me as well. So that little clip there really, I think, captures some of the voices that we've sought to get on the podcast. You know, we've had some of the leaders, some of the patients, some of the experts, and it's definitely been a learning journey for us. And I'd like to, first of all, it's a bit unusual for myself and Noreen and Eamon to be on a webinar. We're usually in the background supporting other people on the webinar, so it's a bit unusual for us to be on screen here. But I'd like to thank Eamon and Noreen and the other team members, Susan and Lisa, for all their work on the podcast today. But it has definitely been a learning journey. Guys, Eamon, if I start with you, what do you think of when you hear those voices coming in on the podcast series?
A few things, really. I mean, I can't believe, and you said it at the start there, I was thinking, God, is it 2 years? That clip of Tommy, that was my first podcast. And I mean, you know, it was a lovely one to start with. He really just wanted to share his story and, you know, was very very giving in terms of just sharing his journey and everything. And it was a lovely podcast. And he actually, you know, when it was released, he was visiting his grandparents in Australia, and he sent me an email asking me if we wanted to do anything else, that he was more than happy to, you know, to come back. And the other thing, actually, sorry, just before you go to Noreen, that struck me was he talked about the physiotherapist who signposted him to the Living Well program. And it was a simple conversation. It was a simple just referral onto that service, but it made a huge difference to him. You know, and just that simple referral, just signposting people to you know, to services, I just thought what really, really struck me.
Noreen, what jumps out at you when you're reflecting on that?
Yeah, no, to me, really, it's all about the story, and it's all about providing the platform for the people to tell the story. And I suppose listening to the CEO as well, there's very few of us in the HSE who don't know Mrs. O'Neill and haven't heard a little bit of her story. So I think that's the biggest thing for me, is giving people the opportunity to tell the story, whether it's a personal story or whether it's through the service that they're looking after or that they're working in.
What do you think you've learned from the podcast and experience yourself, you know, practically, and, you know, in terms of the stories telling and the practicalities of sitting in front of a microphone?
Well, what I've learned is I much prefer to be asking the questions than to answer them. That's certainly one thing, Fergal. But, you know, what I have learned is that there is a need for us, that we have a lot of listeners, and that we're gaining momentum as the time has gone on. And I think that we are giving the opportunity to people to tell their stories or to showcase their service. People maybe who wouldn't ordinarily get an opportunity to do so. They may not be working in an area that is highlighted, say, in the mainstream media. So it is giving them that opportunity. And also for the patient representatives that we've interviewed as well, it's just, again, giving them a platform and an opportunity to tell their story. And people can relate to it. So yeah, I think it's really working, and it's been a lot of fun, and it was daunting at the very beginning, and it's still daunting, because you have to do a good bit of research, but it's been a really good experience so far.
Yeah, I think we all had to get over the issue of listening to ourselves, you know, and just kind of forget about that. And as you said, it's not about us, like we're just facilitating it and trying to give the person a platform. Eamon, what have you learned along the way?
Yeah, for me, I mean, I was, as you know, I don't mind saying, reluctant to do this at the start, but yeah, it was that listening to your own voice. I just had to get over myself, really. But yeah, just the people that we've met and their stories and their willingness to share, and it's been able to have that in-depth conversation with somebody as well. I think that's been really really interesting for me. And just to hear people's stories, you know, has been great.
I think there's a few different ways that I've seen you guys kind of getting really engaged on it. Like Noreen just said, there's sometimes an episode comes to us that we haven't been working with, and you have to do that bit of research. And other times you're working deeply. You know, you could be like Noreen, you're working on that, on the stress balance program. You know, that might be a podcast in the new year, but you're very kind of deep on that. So, you know, like oftentimes Eamon and Noreen, you come back after doing a podcast and you think, like, we're actually learning in the process of doing ourselves. I know that it's not about us, but like you do learn an awful lot with that amount of face time, and we're trying to put that deep conversation out there for everybody.
Yeah, and it's to do justice to the guests that we have and the people who come and talk to us, to give them, to make sure that they're getting the time and the you know, the space to get across there.
Just to make sure that just to make sure that we get their key messages out as well, that although we know the podcasts are pre-recorded, not like this, it's to make sure that we look at what they want to get across and ask them it in a certain way so that they get their message across, and that maybe the listener then can associate with that, and that we'll be able to signpost and think about the audience and who and what they need to hear and how it's going to benefit them. So that, to me as well, is always really important, and to really go through it and make sure we've covered the key aspects of the messaging for people.
Yeah, like going back to Gary's presentation, there's so many people listening to podcasts for enjoyment, for comedy, for entertainment. But we have a communications objective to meet. We're not there for the lols. You know, we have an objective, a communication objective. Like it is a corporate channel, but we are trying to, as you said, Eamon, put a bit of depth, and as you said, Noreen, get the story into it to make it hit home, I guess, so people are make an impact.
Yeah, I think as well, sorry, Fergal, just on that, I think, as Gary showed there, it's podcasts, they're a very busy space and people look for particularly health information, I think, as well. They look across different channels to get that information. So, I mean, the quality of the guests and the preparation in terms of their content, and it's all, as we know, it's all evidence-based, which is really important. So I think, we are the health service, so it's important to be out there and giving this platform to people who want to get their stories, or certainly the stories about their services across.
Yeah, and Eamon,
sorry, go ahead, Noreen.
No, the other thing is when you have the expertise of the people within the HSE, it's incredible the breadth of experience that they have. I mean, they could be working in the health service for 20 to 30 years, and they believe so much in what they're doing, and they're passionate about it. And they like Eamon says, it's all based in evidence, but they just have to show up as themselves, and their commitment and their professionalism just shines through. And it's really incredible. And most of the people that we interview love their job. That's the truth of it. And they believe every day what they're doing is making a difference in people's lives, and they are. And they know that, and it doesn't matter what level in the HSE that people work in, they are having an incredible impact on the people that they meet every day.
Yeah, one of the funny ironies, just like we were talking about having to get over ourselves, but like when we bring guests on, you're trying to make them comfortable. And it just reminds me of what you just said there about, when they're like 5 minutes or 10 minutes into the podcast recording, and then they forget about the microphone and they're just sharing what they really know. As you said, they've passion, they've experience, and you just need the microphone turned on and it's just flowing out of them. Like it's lovely to be able to capture that. It's rare to have a channel that has a health expertise so much showcased on a weekly basis. That's really valuable for us, I think.
Yeah, definitely. Oh, no, it is. And I mean, if you're talking about the people and how to make them relax, they first of all have to trust you, and they have to know that it's pre-recorded. So if they need to take a break, that they can, or any bit of the people who are on here today, that if they are looking at setting up a podcast or anything like that, that it's not an easy thing to do, but that it is being recorded, so we can go back and we can listen. And once people know that, they usually kind of relax a little bit more into it, and they can take a break throughout the interview if they need to.
What have you been picking up in terms of feedback? Have you been taken back by some of the feedback that you've got? I know I certainly have been. Like, it's not every day that people contact the HSE to say thank you for things, but they've certainly reached out on some episodes.
Yeah, I suppose that feedback has been great, but in terms of the usefulness of the episodes as well. I mean, I would have done a few episodes on obesity, and just that, in terms of the usefulness and the content, we've had feedback that's I suppose that's just shone a light on something in terms of stigma, and just really kind of opening those conversations up a little bit more. So that's been great.
Yeah, there's a good few subjects that are, the stigma. Like, I know, Eamon, you've done the HIV podcast. There was a lot of conversation about stigma there. The obesity podcast were some of our most popular podcasts, but our most popular podcast ever was the menopause, Noreen, that you did with Caoimhe Hartley and one of our own colleagues in the health service. That content, people are called, they want it. If we can just put it in a consumable way, I think there's an audience out there, isn't it? That's what we're finding.
Yeah, no, absolutely. And I think you can see by the numbers that is the type of information that people are looking for. So as time goes on, we can look over it, we can reassess what we've done already and how we can make it, or give them more information maybe on those different topics or those different subjects. So yeah, I think
one of the other public services or Teagasc, where, you know, they work, they're funded by the Department of Agriculture, but they were one of the podcasts that I had kind of looked at and spoken to before we went out. You know, they kind of gave me some confidence that they were actually speaking to an audience of farmers on a weekly basis through their, you know, they have a variety of different podcast series, and they're doing webinars, and it just kind of, I suppose, I know that we want to engage within the health service, but we also want to engage outside and with the public. So it's trying to use the consumable format of a podcast. You know, as Garry was saying, you can listen to it on the move, and there's lots of things. Is there any particular episodes that you think about, you know, that kind of, you know, that you passed it on to other people yourselves? Like, you know, not one of your own even, that you thought, I'm going to share this with people.
Well, you know, for some reason, women of my age may be interested in. So I have shared the menopause one. Maybe that's why the numbers are so high. But there's many of them that I've shared. You know, you've got the one on the Understand Together, and it's the patient reps and the service users that have made the difference in the podcasts, and they're the ones that can really tell the story, and they spend so much time sharing their story. Like Anya, Anne Lawler from the Patients Forum, and she's worked tirelessly over the years to try and help and improve services. And a lot of people that come on haven't had always the best experience within the health service, but they're, you know, coming on, telling their story, trying to share their story to try and improve services. And it's just incredible the amount of time that they give, just like Tommy that Eamon interviewed at the very beginning. You know, it's the same type of thing.
Okay, Eamon, do you want to answer that before we go on to this few of these questions?
Yeah, I just, I suppose I mentioned Tommy, but I'd have to mention Susie Burney as well from the ICPO, just in terms of sharing her story. And, you know, Aoife Cummins as well, talking about HIV. There too, that particularly stuck with me. And I suppose what really stuck me in that was language matters. And we hear that time and time again, you know, and at a time when you're, you know, it's all about budget and bottom line. The thing that strikes me, you know, just talking about different subjects, was particularly for healthcare professionals, it's just how, and I know a lot of them are, and a lot of them are so caring and you know, are under pressure, but just it means so much to, you know, if you're coming in to talk about a sensitive topic like obesity or like, you know, HIV or whatever it is, just that language is so important.
Okay, I just want to have a look at some of the questions here, because we might be able to answer some of them live here. People are asking, somebody asked, is it an idea to do video as well as audio when interviewing guests? That's absolutely been a common way of doing podcasts, having video. We've only done that once or twice because it's extra time and extra expense, really. So we usually do audio only and then do photographs of the guests to promote. But you can absolutely do that. That's kind of it's not an unusual. You see a lot of videos on YouTube, and some of the Spotify podcasts have full videos of their podcasts as well. Yeah, we're happy to take, somebody else has asked there, do you take ideas for podcasts? Yeah, we always call out our email address, and sometimes, like, I suppose more often than not, we're not able to respond to every idea, you know, with the podcast, but definitely we are open for business, and a lot of our podcasts have come from suggested ideas, suggested guests. But we're always looking for alignment with the HSE health and wellbeing objectives in terms of communications and highlight priorities for the HSE. What other questions have we here? In terms of tracking the audience, it is a challenge. We can obviously track downloads and listens on YouTube, but in terms of getting a breakdown of demographics, we don't get a breakdown of demographics of listenership. But we do, I suppose, look at who we're talking to in the podcasts. Like we specifically went out late August this year with the back to school episode that Noreen did with the Early Healthy Childhood program, and we did a screen time for young people episode, and we did a healthy lunchboxes. You know, so we thought the parents are, you know, they're engaged, like they're working up to go back to school with their children, and let's get some podcasts for our parents, and that seemed to work very well, and we saw very high engagement in those. So we're kind of planning it with what's going on in people's lives at that time of year. And we're not always targeting episodes to parents, so it's different strokes for different folks, and we're always kind of watching the numbers to see, did we put this under people's nose in the right way? Did we promote it and sell it in the right way? So there's a lot of things go into the mix. I'm conscious of the rest of the webinar that we planned here. So I might come back to some of these questions. Somebody's asked, is it expensive? It can be very cheap or very expensive, depending, like you can do it in a very cheap way. And somebody's also suggested that they're doing it on using Riverside, and Riverside would be a good value way to do it. And it's a common way to record your podcast. One of the key things that I'd say to a lot of people that ask me, well, we want to develop a podcast series. I ask them, do you want to put some of your content into the podcast format, or do you want to have a whole series? You're going to keep that going.
Yeah.
So, I need to think about long term. So I'd just like to thank Eamon and Noreen for that input. Appreciate it. And we're going to invite Sharon Lambert. Sharon's done some research in relation to mental health stigma and engagement with podcasts, and she's going to give a short presentation now. Thank you, Sharon. The floor is yours.
Thanks, Virgil. So I'm just going to pull up some PowerPoint slides there and talk to you about some of the research that we've done here in the School of Applied Psychology on why people are listening to mental health related podcasts. So I suppose my interest in this came about as a result of appearing on a couple of podcasts, and I was really struck by the amount of contact I received afterwards from members of the public, where they had come across a term or a concept or an issue related to mental health or addiction that they hadn't heard before, but it was very important or relevant to their lives, and they were looking for more information. So in psychology, I'm going to say in the 1960s, there was a very famous psychologist called George Miller, and he was the president of the American Psychological Association. And he said that one of the things that people had to do, especially in psychology, was to give psychology away. So often people who need access to information about difficulties or challenges that they might be experiencing, whether it's physical health or mental health, find it sometimes difficult to access the information or to find it at a time that works for them. So I suppose in thinking about the research that was in the back of our minds was, our podcast a potential way to give psychology away and to give away information that we know. And then thinking about my own experiences of being podcasts, the Blind Boy podcast and the Two Hours podcast, where I spoke about mental health and addiction, and that is such a big issue for so many people, and sometimes they're unsure about where to get the information from. So Nisha O'Quilta, who was a master's in applied psychology student here in UCC, and I worked on a project. So the first thing we did was we looked at the existing literature, and there wasn't much. There was very little literature on, mental health related podcasts. Who's listening to them? Why are they listening to them? And are they useful or not? What there was a handful of studies. These are them. So increased positive attitude towards mental illness, an improvement in mental health literacy in children, successful delivery of educational material to professionals, and positive addiction recovery outcomes, promotion of physical activity, delivery of interactive self-determination interventions, and the dissemination of educational content about diabetes and also about obesity. So in our study, there were 722 participants, and it was an online survey. There really, I suppose the survey had a list of questions that people had to answer. And then there was a separate section at the end, which we often put in our service, which was any other comments. And in my experience, nobody ever fills that out, except maybe one person might say this was a rubbish survey or something like that. But what was very interesting about this particular study was the amount of people who filled in the any other comments and the level of detail that was supplied in it. We had something like 60 pages of comments when we printed it all off. We have never seen that before in any of our other surveys. So what it told us was that this was a topic that was really important to people, and people were very invested in the topic. Another interesting, so there was, some interesting findings. So, the majority of people who were listening to mental health related podcasts are between the age of 25 and 39, but there's a good few people between the age of 40 and 64 who are also listening to mental health related podcasts, and then it tapers off once you get over 65s. What was also very interesting as well was that, and I suppose not surprising, that people who were accessing mental health related podcasts was that 73% had access to mental health services and 82% had described themselves as struggling with their mental health. In terms of how often people were listening to mental health related podcasts, so the majority of people were listening to mental health related podcasts about once a month. About a quarter of people listening to them 2 to 3 times a month. And then about 20% of people were listening 2 to 3 times a week, and a very small number of people listening daily. The reasons why people were choosing to listen to mental health related podcasts were academic and professional. So people who were working in the area of mental health were listening to mental health related podcasts. There were people who were listening to them for entertainment purposes. 27% of people wanted to learn about mental health, 30% to learn more about themselves, and just under 10% wanted to learn about others. So people who had lower levels of education tended to access mental health related podcasts more often than those with higher levels of education. And I guess that's what that tells us is that podcasts are filling that space for people who are currently not in education. So, if you're privileged enough to be able to go to college or to university, you're surrounded by a whole load of information that's very useful for learning. If you're somebody who hasn't had that opportunity, mental health related podcasts were providing that information to people. So in terms of the any other comments, so as I said, a huge amount of data there, about 60 pages of comments, and that was analyzed thematically, and what we found was it could be broken down into different themes and sub-themes. So a main theme was accessibility. So what people liked about the podcast was how accessible they were. It's the majority of podcasts that people want to listen to are free. You can listen to them at any time of the day or the evening. So Fergal talked there about, maybe parents. So, you have windows in the day. Everybody has windows in the day where they might have an opportunity to tune into something. The language that's used in podcasts was accessible as well. So sometimes when we go for appointments, whether it's a physical health issue or a mental health issue, we can feel overwhelmed. And if we feel stressed, we mightn't have understood everything that was said to us, or there might have been a word that we didn't understand and we feel embarrassed to ask about that. So the language and using ordinary, everyday, non-scientific language was really appreciated by listeners. Mental health literacy then, so what we learned was that it was improving people's mental health literacy. So new perspectives, thinking about issues in different ways, getting a huge amount of knowledge acquisition, so learning more. It was reducing stigma, and it was increasing help seeking. So we had comments like, it was particularly where people had heard people with lived experience talking, so they would say something like, when I heard such and such guest on such and such show talking about their lived experience of depression or anxiety, eating disorders, addiction issues, it made people feel less alone, and it made them realize that help was available and that they didn't feel shame in reaching out for that help. In terms of potential pitfalls that were identified, I think there were, out of the 600 odd people who wrote in the other comments, there were only 2 negative comments out of the 600, and or sorry, 4 comments, and they fell underneath this. So that podcasts are unregulated. Anybody can set up a podcast. We do know that some podcasts are good for your mental health, and some podcasts are not good for your mental health. So podcasts that seek to polarize people or to focus on quite toxic conversations are not good for people's mental health, but there are loads and loads of really good podcasts. The other potential podcast as well was that somebody might find an episode triggering. So it might bring up something unexpected for a listener. So I suppose the response to that is to make sure that you always have, trigger warnings at the start of your podcast, if it's going to contain content that could be distressing to people, that these are the topics, and then people can choose when is a good time for me to listen to something like this. Reassurance was a huge theme, so it gave people connection, validation, and normalization, and lived experience. It gave people hope in their recovery journeys when they heard the lived experience of others. And it also made them feel like, even though it was them on their own listening to this content, it made them feel like they were part of a community and there was a sharing of experience. So in terms of one of the things we asked is, how useful do you find a whole range of services for helping you to understand your mental health related difficulties or challenges? And podcasts came out as the most useful for helping to understand about your mental health. And it's because people had time to sit and to listen. They could play something back, they could keep listening. And they talked about sometimes how when they were in an appointment, if they were stressed or anxious or worried, that they might not always take in all of the information or understand it, and that having access to the podcasts helped to reinforce that learning. So people appreciated education from experts, trained psychology professionals as guests on shows, but equally people also appreciated lived experience. In fact, what they liked was a good mix of both. People could decide when, where, and how much to take in, and they can go back and they can revisit the episode if they want. So in terms of what people were, what is your main reason for listening? We asked people, and it was to learn new information and skills, to normalize problems and foster connections, increase your understanding about yourself and your circumstances, reframing challenges and giving people hope, consider making changes to my behavior or circumstances, develop new ways of dealing with problems, help acknowledge negative emotions within myself, and process painful feelings and experiences at a safe distance. So you can see there, one of the participants said, I'm less hard on myself. They have encouraged me to open up and speak about my issues. So in conclusion, so there was 2 research papers came out of that particular study. We have done other studies about podcasts in terms of how professionals are using them. I haven't gone into those today. I didn't have enough time to go through all of the different pieces of research, but there is evidence for positive outcomes of listening to mental health related podcasts. Podcasts influence the development of mental health literacy. They reduce stigma and increase help-seeking behavior. And there is some caution urge in relation to potential misinformation or disinformation. And it is better for people who are experiencing physical health or mental health related issues, it's better to ask a practitioner what podcasts they recommend, particularly when you're looking overseas at some of the podcasts that are being generated in other jurisdictions. So thanks very much, and I'll hand back over to Fergal and Sheila.
Thank you very much, Sharon. That was really, really insightful. There's so much information there. It gives us a bit of confidence, and I know that'll be very helpful for our own team. And Noreen, who was speaking earlier with us, works in conjunction with the HSE communications team working on mental health literacy. So I think there's learning for us all there, and we have a couple of mental health podcasts. But now, Lucas, we have to move on because we're very tight for time, and I'm really delighted to welcome Síle Seoige as our special guest today. Sheila doesn't need any introduction. You're a household name, Sheila. You're an experienced broadcaster and host of the Ready to Real podcast. There you are there now, the Ready to Be Real by Síle Seoige. So you've been going on that for a few years now. Can you tell us why you got involved in podcasting yourself?
I suppose really I was a big fan of listening to podcasts, and I've just really enjoyed listening to Sharon's presentation there. I took so much from it, and Garry earlier on as well in particular. And what Sharon was saying there, it really reminded me of like 13 years ago when I was going through cancer treatment. I wasn't a listener of podcasts because they weren't really around. Whereas I know that if I could go back in time and I had the access to the amount of podcasts that are available now, that would have been an incredible resource for me at that time. I got into them about 10 years ago. listening to them, and I hummed and hawed over doing it myself because I came from traditional media. I've worked in media for 26 years, and I came from, you know, TV, radio, where you'd get a very limited amount of time with a guest, and you'd have to get these really compelling life stories done and dusted in like 8 to 10 minutes. And you know yourself, Fergal, that's not an easy thing to do. So you're kind of hurrying the guest along through what often is a really emotional experience for them. So I knew that with podcasting, you had the freedom of time. So I was a fan of them. It was something I wanted to do, but I was nervous about doing it because I kind of felt like, oh, people will expect a certain standard when you come from professional broadcasting. But the great thing is people are very forgiving. And we know now through COVID, I started my podcast just before COVID happened. So it kicked off in 2019. But during COVID, obviously, people were recording in their wardrobes. They were recording on their phones, which I was. And the listener was very forgiving because we just wanted the content. We wanted that connection and content, and it didn't really matter how we were getting it. You know, often the audio wasn't brilliant, but we got away with it. And I think it opened things up hugely. And then there was a big explosion in the popularity of podcasting. But for me, if I was to say one word, why I love podcasting, it's the freedom. But with that, I will add on what Sharon was saying there is really interesting. It's because it is unregulated, and something as somebody who's not a trained psychotherapist or a counselor, I'm aware of really covering myself. So I'll always have topics covered. I'll always make people aware of intense subject matter. I'll always signpost it at the end or include it in the show notes about resources and, you know, things like just helplines and ways to help yourself, because I'm mindful of the person listening often could be quite vulnerable, and they're opening themselves up to listening to something often can be very harrowing. So we need to be mindful as podcasters as well. There's a responsibility, I think, that comes with it, and that's probably down to the individual. But I think it's a brilliant medium. I think it's only going to get better and better. I think it's really exciting, and I'm really proud to call myself a podcaster.
Good. And the title of your podcast, it reminded me of, you know, everybody wants to be marketed as authentic now. Authenticity is very, you know, it's just gone viral as a need for every marketeer. But your podcast, Ready to Be Real, is trying to have a conversation with people when they're, as you say, ready to be authentic. Is it?
Yeah, and I think it's based on my own stuff, really. You know, I mentioned it there. I went through cancer 13 years ago, and I went on my own overused term journey with that, and I learned a lot about myself, and I realized that actually we get one hit at this thing called life. You know, whether we believe in the concept of an afterlife or otherwise, we're here now. This is our life now, and we get one shot at it. And I knew how damaging not living authentically was for me personally. So I'm only interested now in talking to people who are ready to have real conversations, you know. So I think it's almost like an unwritten contract when somebody agrees to be a guest in the podcast. They know they're signing up to real talk, you know.
Yeah, and I know that you're still doing some charity work. I see that you're coming to the Midlands very soon in some of your cancer charity work. Fair play to you, because you're keeping that work going on in the background. Can I ask you? Can I ask you in terms of that? You know, you're sharing your story, and any listener to your podcast will know a bit. You know, they get to know you as well. Do you find that is that a challenge for you, or as you said, it's just either this is me, like take it or leave it?
It's a benefit. It's a huge benefit, Fergal. I love it because I feel like coming from, as I said, from, you know, regular TV and radio work, you're only showing a certain side of your personality, or you're fitting into whatever the style of program is. Often you might be reading autocue, you have a set agenda, there's a set kind of a style to the program, and you're fulfilling that. That's your job. But with podcasting, it's really about you just being yourself. And my favorite podcasts that I do personally are the ones where I talk very little. And as you can see, I'm a chatterbox in real life. But when I'm talking to a guest, it's all about them. It's all about trying to create a secure and comfortable environment for them so that they can open up. And I think as a host, once you do that, you know, that's where the magic happens in a conversation.
It was a very emotionally charged episode that you did recently with Rosanna Ruan around her daughter's cancer and tragic passing, and I was literally listening to it, and I thought, like, you were holding back. Well, I felt like I'd plow in talking into the space, you know, that she was finding it difficult. Obviously, it was very emotional telling the story. But you seem to resist the challenge of just filling the void. Let her have the space to talk. I thought that showed a bit of I suppose, resistance to the obvious, just filling the space.
It's interesting you say that, because I do think when I started off, I probably would have jumped in sooner.
Yeah.
I think I've learned over the past few years doing it, because it's a different skill. It's like another muscle that you're learning to exercise for the first time. Podcasting is different from the type of stuff I did before, because as you know, in traditional media, like, in radio and telly, there's no space for gaps.
Yeah.
Pause is a major no-no. Like, you're always trained in radio, don't ever let there be dead air. So if a guest was getting emotional, if they were having a moment, you as the host were jumping in to almost hear them, or, you're okay there. And actually, I find that that's actually the wrong thing to do in real life, because when somebody's having a moment, it's not about trying to fix it for them. At the end of the day, Rosanna Ruan is talking about her daughter is no longer here. Nothing is going to take away her pain. Nothing I say is going to make that better. And sometimes you just need to allow that space to be and get comfortable with the pause, get comfortable with so hard. And there's a real power in that. And I think when it comes to podcasting, that's when you pull listeners in. They're the type of podcast that I find really engaging.
Do you find that how do you regulate yourself in terms of episode length? Do you find that you want to be an hour or go hour and a half? Or,
yeah, it's a great question. Yeah, that's a brilliant question. I have no clue. I'll be totally honest. Anyone who knows me knows I've really no idea of time. And that's why podcasting probably suits somebody like me, because I could talk for Ireland, and I think there's a natural end to a conversation. And that doesn't mean that a shorter conversation is any less in power or in impact than a longer one. But I think all conversations have a natural beginning, middle, and end. So I don't like to put restrictions on myself. The brilliant Garry, who was up there earlier, I often use his fantastic studio, GK Media in Galway. It's one of the best, if not the best studio I've ever been in. And I'm not just saying it. Garry hasn't paid me to say this. It's just a great space. He's a gent. He's a great team. But when I go in there, I mean, I obviously book it for about an hour, but I think he knows me enough at this stage to know we're going to have to give Síle a bit more time, because I could be in there an hour and a half to 2 hours with a guest. Like with Rosanna, I didn't want to rush her. She's talking about something so emotional that it would have been the wrong thing to do to kind of hurry her along. So that's the other benefit, I suppose, to podcasting. You can have a 30-minute conversation or an hour and a half, and often mine run over the hour.
Yeah, you got to meet. I know that you're in your previous television and radio work, you got to meet loads of different celebrities, but you've got to meet a variety of people on your podcast and platform them. And one of the people you had on was Dr. Katrina O'Sullivan, who wrote the bestseller book Poor, and that was a lovely conversation again about celebrating her resilience, but also the people that helped her. I thought it was a lovely section of the podcast where she spoke about the teacher that kind of reached, or that give her a help, and her family. She's in contact with her family and her now, and I just thought that's so remarkable after all these years, that you have that one strong adult making a difference. And then to hear that story being told on your podcast was just, it's great to be able to facilitate things like that, I guess.
It is. And I feel really lucky, Fergal. I get to meet amazing people. I get to have really powerful conversations that have a positive impact for me as a person. But then when I get the feedback from people saying, this stopped me in my tracks, or this helped me in one way or another, that is huge job satisfaction, knowing that you're connecting with people. And the other thing that Sharon was mentioning as well, and that's something important to note, podcasting is evergreen. So the great thing is, and I'm a fan of talk radio, don't get me wrong, I still love listening to News Talk in particular. I mean, I did used to work there, but I do. And there is a space and a place for that. But with podcasting, if you listen to an episode or you're drawn to a certain guest, all you do is you go into the search engines, you search for it, you find it, and it'll always be there unless it's taken down for any particular reason. Whereas radio, if you catch it, you catch it. Yes, you have the listen back feature, but people don't tend to use that too much. Whereas podcasting, they might go back to a host they like on an episode that they didn't hear maybe like 5 weeks ago, and they'll listen to it again. Like, that's the interesting thing when I look at the stats of my podcast. Often it's people who might hear my podcast for the first time and then are drawn to listen to previous episodes.
Yeah, no, people can onboard at any stage of their own personal journey or wanting that type of content. It's great from that point of view. Can I ask you what else you're working on at the moment? You spoke about your earlier career in television and radio, and I know you've done a lot of work in both Irish and English. So is there anything you can tell us about that you're working on at the moment?
Yeah, we just started filming 3 documentaries for TG Cahed last week. So it will be bilingual, primarily in Irish, but three different topics. I'm actually not even sure if I can mention what the topics are, so I might just not say that for now. Not that it's a big deal, but they're juicy, they're important, they're topics that I think impact a lot of us in modern life. And it's about, I will say that the title of the documentary series is Síle Seoige Ag Nochtú na Feeding. So like revealing the truth is essentially what it is. So it's about getting in there, getting deep into a topic and exploring it and learning. So yeah, we just started filming last week. We were filming yesterday in Galway, actually, and again this week in Dublin. So we'll be all over the country with it. We'll be filming probably over 6 months, and they will air, I'm not sure, maybe before the summer, or could even be next autumn before they're actually televised. But alongside the podcast with that, then I do lots of different bits and bobs here and there, and you're voiceovering things, and you're doing lots of different work. So you're kept going,
That sounds like a series that we could be watching out for, revealing the truth. And I think that's it sounds like it's first cousin of Ready to Be Real.
Yeah, I suppose so. Yeah,
that you're trying to do something in depth or showcase some important storytelling and emotion. So the best of luck to you with that. And thank you again for coming on today's podcast. Really appreciate today's webinar. Sorry, I'm getting mixed up in my podcast and my webinar. Thank you very much for your time, Sheila. I appreciate it.
Thanks, Virgo. Appreciate it.
Just before we go, we're going to share a video, if we can, about another podcast that was in touch with us. Just before we finish, we'll play out with the video, but I just want to thank everybody for their time and attention today. I appreciate everyone is busy, and I just want to thank in particular our own national and local communication colleagues who have supported the dissemination and the promotion of the podcast through social media, their website, through the different channels across the country. They play a very important role for us. So I just want to play this video, and we'll close with that. And this is from Shane Martin telling us about his podcast, Music in the Mind. Just gives you another insight into the variety of podcasts that are out there.
Hello, my name is Shane Martin. I'm a psychologist and I'm passionate about music. Myself and my friend Shane Mitchell from the trad folk band, highly renowned, Dervish, have got together and we've created a series called Music in the Mind. It's a podcast, and in this podcast we speak to people whose lives have been touched by music, and we explore the psychology of music. Music is something which can calm the mind and lift the heart. It's everywhere. And there's a lot of people who do not realize that music has many therapeutic benefits. If you like, music can be an informal source of support for people who are under pressure, stressed, feeling low. And there's a huge amount of science behind that, particularly in recent decades. So in the Music in the Mind podcast, myself, I kind of sourced a health professional to give us a perspective from science, from psychology, or from psychiatry. And Shane Mitchell, with his contacts in the music business, he sources people from the world of music. We've had some fantastic guests, and we've had a massive response to this already. We're planning a new series as I speak to you now. But we spoke to Martin Hayes, renowned fiddle player, on the whole topic of flow, psychological flow, and how you can become absorbed in the task at hand and lose all sense of anxiety and worry. Flow is a very important thing to achieve sometimes because it's linked to feeling happier in oneself. Hobbies, for instance, give you flow. We've also spoken to people who have found music to be of great help when feeling sad or when bereaved. And we spoke to David McGowan, the renowned funeral undertaker, and his daughter, Brie Jean, who is a renowned funeral undertaker and harpist and traditional Irish musician, about their unique take on how music has been seen by them to be very, very important to people during periods of sadness. And we've spoken to people who are undergoing cancer treatment and who have a Spotify playlist that seems to be carrying them through that very challenging journey. So our podcast basically is trying to reach out to people. We're trying to give our passion for music out to others, or maybe sharing that passion for music with other people who have it already. And we think it's helping people. We've had massive feedback about it, and we hope that it will be listened to by even more people for the second series.